do you recommend to your patients who maybe are starting from an inactive state about, realistic goals to set for themselves when it comes to exercise?
So that's a great question, and I think many times we have patients who are coming from a sedentary lifestyle and they're excited about exercise. We see it a lot around the time of the new year because they're New Year resolutions, and then sometime in February we have a lot of overuse injuries that come in, sprains and strains.
Right. And everybody's gone from the gym. No
one's going to the gym. Slowly but surely, baby steps, and recognizing that you have not been active, and so slowly moving forward. I usually tell my patients that if you're not moving around much, anything you do is better than nothing. Right. And to be forgiving of yourself. So when you get up, it's unreasonable to think you're going to suddenly be able to exercise for 60 minutes and not feel sore the next day. But telling yourself that even if you did exercise, say, I could only do 10 minutes today, but that was 10 minutes more than I could do yesterday. And so just baby steps, and know that it's a long-term goal, that these kind of changes do take time, but sticking to it and doing what you can.
Okay, absolutely, that makes sense. And there are different forms of exercise, and you just mentioned not everybody's ready for that 60-minute vigorous activity. So can you kind of help us also figure out, there's low, there's moderate, there's vigorous. So how do we maybe determine how hard we're working out when we're actually out there doing something?
So basically, if you've not really been exercising, starting with low intensity is the safest. Right. And we do err on the side of safety first. But so walking, low impact walking, swimming, and then just slowly conditioning yourself. And I think it's really based on age and general health and conditioning to help determine what would be the safest level of exercise. But I think having that conversation with your doctor is important so that you don't engage in an exercise program that may actually be destructive for your body, and your physician can determine if you need additional testing or need to see a specialist to clear you for a higher intensity.